Channel. My name is Jamal Sanders. I'm a nutritionist working here in the state of New York, and today I want to talk to you about something that hits very close to home for a number of reasons. And the topic that we'll discuss is heart disease. It hits close to home because it affects not only African American people, but it has affected people in my family in a way that have had a profound impact on me. And so to get started here, I just want to quote that Black adults are 40% more likely to have high blood pressure than white adults. And for those who do, they are less likely under control. High blood pressure not only increases your risk for heart disease and stroke, it can cause irreversible damage to your heart even before the symptoms are noticeable. And so I'm aware that there are many prescriptions that can be taken to help manage blood pressure. But there's a concern that has come to me personally as somebody who deals heavily with foods and preventative health and how nutrients and exercise and a healthy lifestyle can impact the body. I'm seeing that the application of conventional medicine, it appears to have taken precedence over people's lives over long periods of time without necessarily having a finite outcome. The name of this is Should Medicine Be a Life Sentence? So I want to open this up with a case, and I want to talk to you about the case of Miss Thomas. Miss Thomas is a person who in her mid-20s she's now 65 years old, but since her mid-20s, she has dealt with insomnia. She's that kind of person that if you go in a room, no matter how quiet you try to be, if you do just the slightest thing, she's going to wake up and she can't get back to sleep. And this has been going on for years. So she's probably only gotten anywhere from 3 to 4 hours of sleep per night. And you multiply that times 20 years, and now she's in a situation where it progressively became insomnia, where she essentially has learned to live without sleep. Over time, she noticed that she began having heart palpitations. She experiences weakness, dizziness, sluggishness, and most recently she was diagnosed with anemia. She's African American, and so she also has a family history of people who have had strokes, heart disease, high blood pressure, heart valve problems, and more. And so based on her symptoms and based on her blood pressure readings, her doctor decided sometime in her 30s that she would go on a dose, a low dose, but a dose of blood pressure medicine. The only challenge now is that Miss Thomas is still on blood pressure medicine. And she's aging and she's having all these symptoms. And no matter what we do with her diet, nothing seems to change what she's dealing with. So now in my mind as a nutritionist, applying that same care of logic into what she's dealing with, now we're trying to go through the process of elimination for what could this possibly be. She's eating correctly. And no matter what we do, the insomnia persists, she's anemic, and there's other things that are starting to happen with her, things that weren't even present when she was in her mid-20s. So I have some questions, and my questions aren't about the foods because we're managing the foods. The questions that I have are about the medicine. Miss Thomas, when she made the decision to take what the doctor prescribed, and there's a lot of trust there because what the doctor says, especially back then, it was pretty much whatever the doctor said, was right. And now I think there's a lot more focus on patient-centered care, and I think there's a greater number of people now, based on my experience, who are very interested in preventative health. But earlier on, it was what the doctor said goes. So when a person gets prescribed medicine, should that be a life sentence, or at that time should the doctor have, in addition to providing or recommending that prescription or prescribing that medicine, should there also be information provided about what the path to coming off that medicine might be? What are the indicators that would enable a person to come off that medicine? So if their blood pressure is hypertensive, and let's just say that's 140 over 90 or 140 over 100, would the doctor then, over time, if that blood pressure was being managed, the person's diet had improved and they had started being more physically active, would the doctor then be willing to talk about a path for coming off of that medicine? And if doctors are open to that, has it become common practice for them while prescribing medicines to then also counsel a person as to what indicators they might have to improve before they come off? You know, is there a discussion about how a person can come off the medicine? If the answer is yes, are doctors really making patients aware of what they might encounter, what the consequences might be of long-term use of medicine, and what they might experience coming off of them? Then what I found is, as I looked for this information, was that I did what we call a formative evaluation, which is a high-level overview of what's out there on a given topic. And then if I find that there is some evidence, or at least a path to travel, then I'll start to look at more substantial resources, such as peer-reviewed articles on this topic. I did not find any substantial evidence that there was research done on coming off of these medicines. There's a lot of research about how patients can benefit and the impact of these medications on a specific condition, but I found very little, if any, research about what the consequences were for coming off. Now, I'll give you one example here. This one was titled, "Are 3 blood pressure drugs better than 1?" And it says that a combination medicine with lower doses could help some patients reach blood pressure goals more easily, according to researchers. People taking one blood pressure medicine may reach their blood pressure goals more effectively if they instead take lower doses of 3 medicines. So as opposed to comparing people who have come off the medicine with people who take the medicine long term, we're doing research about 1 versus 3. And that still leaves the patient in a position where they're taking medicine either way. Now, there's other evidence out there, and that's the evidence that I think is being concealed here. Because right now the patient is being pointed towards the research that has to do with the effectiveness of the medication, and doesn't tell them the consequences or path to coming off, or how they might deal with it from a preventative health standpoint. So the other piece of the evidence that I think is, and it's almost like it's like an elephant in the room, because everybody's having a conversation about one thing, and it's almost like a diversion that there's something else available. All right. And like I was saying, we're talking about whether or not it's better to take 1 versus 3 medications. So we're given 2 choices, but we're leaving out a major player. Now, the other player is preventative health, which would be the dietary choices that a person chooses to make, and the level of physical activity that a person has, and then on a more holistic level, also the sense of emotional and spiritual well-being of an individual. Now, with regard to fitness, and I'm quoting from the National Council on Strength and Fitness, which was one of the very first personal training certifications that I got. So it says, "It has been shown that most hypertensive individuals medicated for the disease can get off medication with a 10% reduction in body weight and a 25% reduction in sodium intake." So you have 2 variables there, body weight and then sodium intake. And it didn't say they can have a reduction in the number of medicines. It didn't say that they can have a reduction in even one of the medicines. It says that people who are medicated for the disease, because that's what it is, can actually get off medication. And so my big question here is, since it is possible to get off medication, how much research do we have about the long-term impact? Think about Miss Thomas. How much research do we have about the long-term impact of somebody who has not gotten off medication, and where now we're starting to see things with Miss Thomas that were not even present before she started to take the medicine? I personally think that that draws not Miss Thomas and not her food choices into question, but I think it draws question to the other players, to the ones that are being most esteemed as the saviors, where what are the components of those? You know, it's funny when we talk about nutrition, a lot of times we talk about controversy, concepts of nutrition and controversies. You know, is it controversial to choose to use dietary strategies to deal with chronic high hypertension when it's in your family? Or is it more controversial to take blood pressure medicines, possibly 3, over a prolonged period of time, maybe 15, 20 years? Where is the real controversy here? Let's just look at hypertensive medicines. So we'll look at the side effects. It can be symptoms of weakness, leg cramps, or being tired, attacks of gout after prolonged treatment or diuretics. People with diabetes may find that diuretic drugs also increase their blood sugar level. Insomnia, tiredness or depression, asthma, and impotence. So dizziness, injury, even death to a developing fetus. Drops in blood pressure when you stand up, weak or faint if the blood pressure has been lowered too far, drowsiness or sluggishness, dryness of mouth, fever or anemia, headaches, swelling around the eyes, heart palpitations, or aches and pains in the joints. With those central agonists, it says if you are taking any of these drugs, do not stop suddenly, because your blood pressure may rise quickly to dangerously high levels. I think that statement really embodies the reason for this post, which is that, so you're going on this because you're going to deal with the issue, which is high blood pressure, but at what cost? Not only during the time that you're taking it, but what is the cost for coming off? What is the path for coming off? And does that risk outweigh the benefits for that one solitary issue that it's allegedly helping? Are patients being provided with information about how to reduce or come off medicine in the event that they want to? Are they given any advice about the protocol for coming off? Are they made aware of the indicators that suggest that they can come off? What if they hit that 25% reduction in sodium? And what if they are able to reduce their body weight by 10%? What if their blood sugar levels normalize? And what if their health risk factors are being decreased? Are they being made aware that if they check off those boxes, that maybe they would be a good candidate to not live on medicine? Are they being made aware of the complications that they could face while trying to come off? And what are the long-term implications for people who don't have this information? These answers impact my family. These answers impact people who are the same race as me. The answers to these questions impact me personally, as somebody who has had to manage high blood pressure through diet and alternative and healthy lifestyle. I don't want to see people have the opportunity in pursuit to life be in situations where everything else is in question, but we never look at the medication and whether or not it should have been stopped a long time ago. What is the path to coming off of the medicine? What is the path?